Hi Lena, thanks for coming to do a video testimonial for us to help others who might be suffering with similar symptoms that you had. Can you share with us what you presented with 5 months ago?
Well, 5 months ago when I first came here, I had really bad skin problems, and I had a lot of allergies, and I wasn't doing too good. And since then, I've been doing very well now. I feel a lot better, and I've gotten better.
Good. So you had some allergic reactions going on, so that you had white patches on your face and on your arms.
Mm-hmm.
You also were suffering with tremendous nasal, post-nasal drip, itching,
Mm-hmm.
right, of the nose.
Yes.
And what about your eyes?
I used to have this really bad, dry, patchy, itchy, spot on my eyes and my arms, and I'm pretty sure it was eczema and stuff. And since then, I've gotten better, and I no longer feel itchy, and I feel more energetic.
So talk to us about that energy. What I know sleep was hard for you when you were going through this.
Yes.
Tell us about what your sleep was like and what it's like now.
My sleep used to be, I wasn't getting as much sleep as I should have, and I would wake up in the middle of the night, and I'd just kind of drift in and out of sleep, not being able to sleep as well as I can now.
How did that affect your day and your energy level during the day?
During the day, I didn't have very much energy, kind of lazy, laying around, but now I have a lot more energy, and I can do a lot more things than I used to be able to.
Awesome. Okay, so was there anything else we missed? So you had skin rashes, blotchiness, white patches on the skin, the itchy ears, eyes, nose, and yeah, they called that allergic rhinitis. So what had you done prior to this?
What do you mean?
So prior to coming here for help, you had tried some other things, and you'd gone a couple of years suffering with this. One doctor had said you had severe atopic dermatitis.
Well, she was taking medication instead of supplements.
Mom, go ahead and chime in there.
Well, prior to this, she was taking medication instead of supplements that helped her overall health and internal gut. So that made a big difference.
The medications made the big difference, or once she started taking the...
Once we started taking the supplements with you,
Mm-hmm.
Dr. Hoyt, cleansing her inside and just kind of clearing up what was happening internally.
Do you remember how we decided what it was we needed to give her? Remember the testing we did?
The stools and the blood work.
Yeah. Yeah, we ran a gastrointestinal panel. It was a 50 marker, actually it's an 82 marker gastrointestinal panel.
Yeah.
That showed that she had some overgrowth of some bacteria in her gut, right?
Right. Something we didn't even think a young person like Lena would have.
Right.
So it was good to know that from an internal professional.
And do you remember how we arrived at what foods she could and couldn't eat that were triggering inflammation and rashes and things too? Remember that wonderful test?
Yes, pretty much all that she was eating, she was allergic to, the bread, the dairy,
My whole diet.
her whole diet. So that cutting back on all of that definitely made a difference as well.
Okay, so have you been able to follow the diet that even though there were some challenges there, was it doable?
It was very challenging. It's doable. It does take a lot of motivation and dedication too as well to stick to it.
Yeah, and she's done really well. Lena, how old are you?
I'm 12 years old.
12 years old, and Mom had to work, and Lena, with COVID, she's been home a lot, and so...
So a lot of it had to be just on Lena. Lena's drive to get better.
Right,
Yes.
right. So this is a list of your diagnoses before you came in. I'll just put it on the screen here. Atopic dermatitis, rash and nonspecific skin, pruritus, and allergic rhinitis, which means runny nose, which was evident when you first came in. You were on an inhaler. You also had a topical cream, and there were some other medications you were on. There were quite a few medications over those couple of years that you were on. So, are you having to use those anymore?
No.
Yeah, that's wonderful. Well, you've done really well. I'm super proud of you. 12 years old and you rocked it.
Thank you.
Good job.